So the next question, that is question number 13. Gel are most suitable for application on dry skin, hairy areas, broken skin only, and mucosa only. So answer will be that's hairy areas. The gel are most suitable for application on this be hairy areas. Next question coming from, that is liniment and lotion. Liniment are applied to skin by gentle rubbing. This is very, very important. That is gentle rubbing. Answer will be that B. Liniment are rubbed on the skin to produce counter-irritant effect. Okay. Liniment should not be applied on intact skin, hairy skin, and broken skin, and that is muscular area. The answer will be that C. It is broken skin. Okay. So liniment should not be applied. অর্থাৎ liniment apply করা যায় না কোন কেসে না ব্রোকেন স্কিনে অথবা কোনো ইনফ্লামড স্কিনে, কোনো জায়গাতে লেগে গেছে বা কেটে গেছে কিছু হচ্ছে, সেখানে কিন্তু লিনিমেন্ট ইউজ করা যায় না। সো লোশন আর জেনারেলি গ্রিজি সেমি সলিড, liquid preparation for external use, solid preparation, and alcoholic injection. So the answer will be liquid preparation for external use. This is lotion. Okay. Lotion are preferred when occlusive effect is needed, cooling and soothing effect is desired, and deep penetration is required, and high viscosity is needed. So this is answer will be that B. Cooling and soothing effect is desired. In that cases where lotion are preferred. Okay. So next what? Next is suppositories. Are solid dosage form intended for B, that is rectal administration, right? So next which is suppositories melt or dissolve at, see here, room temperature, refrigeration temperature, body temperature, and high temperature. So the answer will be that is here body temperature. See, suppositories melt at, that is body temperature. Common base used in suppositories is, this is cocoa butter. This is the common base used in suppositories. This is cocoa butter. Advantages of suppositories is, that is easy swelling, about fast pass metabolism, fastest onset of action, and then this is pleasant taste. So answer will be that about fast pass metabolism. Okay. So because এই দেখুন এখানে যে suppositories এর অ্যাডভান্টেজ হচ্ছে about fast pass metabolism. Okay. Next হচ্ছে pessaries. Pessaries are dosage form intended for, answer will be C, vagina, or you can say vaginal use, right? Pessaries are mainly used for, see, vaginal infection and contraception. Okay. So pessaries are similar to the suppositories except for, see here, route of administration. Okay. Whenever suppositories and pessaries used in vagina, and suppositories this is rectum. Okay. So this next what? Best topical preparation for dry eczema. That answer will be C, ointment. Okay. Best topical dosage form for oozing skin lesion. The answer will be that is paste. Okay. So next what? Which topical preparation provide maximum occlusive effect? The answer will be D, ointment provides maximum occlusive effect. Non-greasy topical preparation is, what is this? The answer will be C, this is non-greasy, whereas ointment, paste, and that is oleaginous cream, all are greasy preparation, whereas gel, this is non-greasy topical preparation, right? A topical preparation requiring shaking before use is, the answer will be C, this is C. Okay, that is lotion. Suppositories and pessaries mainly differs in, what is this, route of administration. This is very, very important. Already I discussed previous question. So suppositories and pessaries. Okay, and here this is the quick summary. See here, ointment, this is greasy semi-solid. Dry skin you have to apply. In case of cream, this is emulsion, you have to apply in hairy or moist area. This is paste, this is, it's contain high solid, this is used as protective. Gel, this is non-greasy, it is used in that is hairy areas. Liniment, this is liquid, or you have to rub. Okay, mainly used in muscle pain. And lotion, this is the liquid with no rubbing. Okay, and used for cooling purposes. And this is suppositories, these are the solid used in rectum, and pessaries solid used in vagina. Okay, so this is very, very important. Next, that is what? Next, that is nasal preparation or air preparation as per the PCI education regulation 2020. So this is nasal and air preparation. So nasal preparations are dosage form intended to be administered through what? through mouth, eye, nose and eye. So here see nasal preparation, that means you have to apply these types of dosage form to the what? The nose. The answer will be C here, nose. Okay. So answer will be, this is C, nose. Right. Main purpose of nasal preparation is to provide what? Only systemic action, only local action, local systemic action and rectal action. So the answer will be here C, nasal dosage form may act locally, for example decongestant, or systematically, that is hormone. So answer will be, that is C, local and systematic action. এই দুটো অ্যাকশনের জন্য কিন্তু nasal preparation ইউজ করা হয়ে থাকে। Common nasal dosage form includes, that is B, nasal drop, nasal spray, nasal powder, right? Nasal drops should preferably be high acidic, high alkaline, or you can say that is isotonic or non-irritant and highly viscous. So here nasal drop always be isotonic, okay, and non-irritant. Okay. So here next, what ideal pH range of nasal preparation? So ideal pH range is that 5.5 to 6.5. So okay, so this is 7 is that neutral pH, okay, and 5.5 to 6.5, that means what? That means a little bit acidic, right? So here preservatives are added to nasal preparation mainly to what? Improve taste, prevent microbial growth, increase absorption and increase viscosity. The answer will be that preservative means prevent the microbial growth. Okay, preservative means it's prevent the microbial growth. Viscosity enhancer in nasal preparation are used to, what is this? B, increase residence time in nasal cavity. So that is the use of viscosity enhancer in nasal preparation, increase residence time in nasal cavity. Okay, so next is what? Nasal spray are preferred over drop because they provide uniform distribution. Okay, so nasal spray provide uniform distribution. Okay, so preferred over drops. Next, what? Nasal routes is advantageous because it avoid fast pass metabolism. আমরা সবসময় জন্য দেখবো যে ওরাল রুটে কিন্তু ফাস্ট পাস মেটাবলিজম আসে, কিন্তু নেজাল রুটে কিন্তু ফাস্ট পাস মেটাবলিজম আসে না। ওকে, তো নেক্সট হচ্ছে দেখুন, এ ডিসঅ্যাডভান্টেজ অফ নেজাল প্রিপারেশন ইজ পসিবল ইরিটেশন অফ নেজাল মিউকোসা। নেজাল মিউকোসাতে দেখবেন কিছু কিছু সময় ইরিটেশন তো দেখা যায়। নেক্সট হচ্ছে এয়ার প্রিপারেশন বা ওটিক প্রিপারেশন, বারবার করে পরীক্ষাতে আসে। এয়ার মানে হচ্ছে ওটিক প্রিপারেশন। ওকে, তো air preparation are intended to be administered into the what? Nasal cavity, external auditory canal, middle ear directly, inner ear. So the answer will be C here, answer will be B, air drops are applied into the external auditory canal, right? Air preparation are mainly used to treat, that is C, ear infection and inflammation, right? Air drop are generally formulated as tablet, suspension and then capsule and powder. So the answer will be, that is B, air drop সবসময়ের জন্য কিন্তু কি either solution এ থাকে অথবা suspension এ থাকে। Okay, so air drops should ideally be that is isotonic and non-irritant. Okay, so answer will be that C, isotonic as well as non-irritant. The temperature of air drop before administration should be very cold, very hot, and next is that close to body temperature and below room temperature. So the answer will be that this is close to body temperature. This is the temperature of air drop before administration, right? Next is what? Preservative in air preparation are used to what? Prevent microbial growth. Once again the preservative দেখতে পাচ্ছেন এখানে, preservative এর মেন কাজ হচ্ছে prevent microbial growth. Air drop should not be used when tympanic membrane is intact, external air infection is present, tympanic membrane is, that is perforated, and mild that inflammation exists. So answer will be here, tympanic membrane is perforated. So here the answer, the certain air drops can damage the middle air structure if membrane is perforated. Okay, so next one, vehicle commonly used in air drop includes B, alcohol, glycerin or oil. Okay, so আমরা যখন এয়ার ড্রপ তৈরি করি সেক্ষেত্রে আমাদের যে কেরিয়ার থাকে সেখানে কি থাকে, হয় অ্যালকোহল থাকে, নাহলে গ্লিসারিন থাকে, নাহলে অয়েল থাকে, রাইট? Next দেখুন, viscous vehicles in the next question, that is what that is from powder and granules. Okay, so powder are best refined as liquid preparation, solid dosage form, semi-solid dosage form, and gaseous system. So the answer will be here solid dosage form of finely divided drugs. So this is the key. This is powders, right? Next, what granules differs from powder mainly because granules are what granules are, that is C aggregates of powder particles. This is granules, right? Okay. Next is one major advantages of granules over powder is number B, better flow properties. Okay. Powder having better flow properties. খুব সুন্দরভাবে flow হতে পারে। তো that is the advantages of granules over powder. Okay. Next হচ্ছে কি না insufflation. Insufflations are powder intended to be administered via, the answer will be C, that's body cavity, nose, air and throat. Okay, that is insufflation. So next is that insufflation powder should be what? The answer will be sterile and very fine. Okay. And that's device commonly used to administer insufflation, অর্থাৎ insufflation কোনো যে ড্রাগ রয়েছে কোনো যে ড্রাগকে আমরা অ্যাডমিনিস্ট্রেট করতে গেলে আমরা কি ধরনের ডিভাইস ইউজ করে থাকি? ড্রপার, সিরিঞ্জ, ইনসাফলেটর and nebulizer. So the answer will be C. This is what? That is insufflator, right? Main disadvantages of insufflation, that will be difficulty in dose control. Okay, accurate dosing is difficult with powder. Next is that is from question from dusting powder. So dusting powder are intended for oral use, inhalation, and here external application on skin and injection. So here the answer will be dusting powder are intended for external application on skin. So answer will be C. Dusting powder should be, that is coarse and gritty, fine, free floating and non-retent, sticky and moist. So answer will be B, fine, free flowing and here non-retent. Okay. Medicated dusting powders here, this is medicated dusting powder are mainly used for cosmetic purpose only, therapeutic action on skin, systemic action, rectal administration. So B here, therapeutic action on skin. Okay, so the answer will be this is medicated dusting powder are mainly used for, the answer will be therapeutic action on skin, right? So non-medicated dusting powder are mainly used for the B, absorption of moisture and protection. This is non-medicated. Okay, mainly use করা হয় non-medical purpose. Okay, dusting powder as you usually supplied in here botuloid dropper, that is stiffer, that is sifted cup containers, ampoules and blister pack. So this is there. This is the answer will be the B. And then evaporations powder. Evaporations powder contain a mixture of, that is B, acid and alkali. That means typically citric acid and sodium bicarbonate its content, and evaporations occurs due to the formation of C, this is the carbon dioxide. Okay, evaporations powder should be dissolved in, answer will be that B, cold and lukewarm water. Okay, and main major advantage of evaporations powder is, that is B, faster dissolution and improved, this is permeability. Okay, and main disadvantage of evaporations powder, the answer will be here, this is B, that means what? That means moisture sensitivity, right? Next that is evaporations granules. Evaporations granules differ from evaporations powder because granules is that B have better flow and less dust. Evaporations granules are prepared mainly to, that is increase dose to improve stability and handling, reduce solubility and increase bitterness. The answer will be that B, improve stability and handling. That's evaporation granules are prepared mainly to improve stability and handling. Okay. Method commonly used to prepare evaporation granules is, there is dry granulation or wet granulation method. Okay, evaporation granules are preferred over powder because they are cheaper, are less hygroscopic, are have proper, there is pores test and are injectable. So answer will be that is B, are less hygroscopic, that is key evaporation granules. Okay, next হচ্ছে কি না which powder must be sterile? Dusting powder, insufflation, evaporation powder and bulk oral powder. So the answer will be insufflation. Okay, best dosage form to improve palatability of bitter salt is that bulk powder, dusting powder, evaporation granules and insufflation. So the answer will be that C, evaporation granules. Okay, a powder intended for moisture absorption and skin protection is that non-medicated dusting powder is used for only moisture absorption. দেখবেন যখন গরমকালে ঘাম হয় বা কিছু হয় দেন আমরা ইউজ করে থাকি, that is কি, that is non-medicated dusting powder. CO2 released in evaporation preparation helps to that's reduce stability, improve dispersion test, increase viscosity and reduce absorption. So here answer will be improve dispersion and test due to the release of CO2. Which preparation requires airtight moisture proofing package? So this is evaporations powder. Okay. So next is that is what? Next is that is which form shows best, that is better patient compliance than powder? So bulk powder, evaporations granules, insufflation, dusting powder. So the evaporations granules show better patient compliance than powder, right? So dusting powder, see here, dusting powder should not be applied on intact skin, moist wound, dry skin and skin fold. So the answer will be B, that is moist wounds. Okay. So primary purpose of granulation in evaporations dosage form is to here reduce the hygroscopicity and dusting, right? This is very, very important. So see here, insufflation, always body cavity is very fine, they will be and they will be sterile. Dusting powder, they can be used external purposes, fine and non-irritant. Evaporations powder, it contains acid and alkali, it is little CO2. Evaporations granules is better flow and less moisture propellant. Okay, this is very, very important. And next is that is here, this is sterile formulation. Okay, this is sterile formulation. So sterile বলতে আমরা কি বুঝবো না, যে সেই ধরনের প্রোডাক্ট which are sterile. Okay, so mainly আমরা এটাকে জানবো যেটা হচ্ছে that is parenteral preparation, right? Parenteral preparation means injectable. So here sterile pharmaceutical preparation are those preparation which are free from toxic substance, free from microorganisms and free from preservative and free from excipients. So answer will be that free from microorganism, means injectables কিন্তু আমরা directly blood এ input করে থাকি, so সেই কারণের জন্য it is free from microorganism. Okay, so sterile dosage form are essential for parenteral and ophthalmic preparation. অর্থাৎ sterile dosage form আমরা কখন ইউজ করে থাকি, মেনলি যখন ডিরেক্টলি ব্লাডে আমরা ইনজেক্ট করছি অথবা ডিরেক্টলি আমাদের অপথ্যালমিক কোনো প্রিপারেশন আয়ে আমরা অ্যাপ্লাই করছি, তখন আমরা কিন্তু স্টেরাইল ডোজেস ফর্ম ইউজ করে থাকি। দ্য মেইন রিজন ফর মেইনটেনিং স্টেরিলিটি টু improve taste, prevent infection, improve stability and improve solubility. So it is used to prevent infection. Injectables are sterile preparation intended for administration by injection, right? So next, what common route for administration of injectables includes all except intramuscular, intravenous, intramuscular, subcutaneous and oral. So oral is not a common route of injectables. Injectables must be free from C, that is pyrogen. Okay, pyrogen, because pyrogen can cause fever and shock, hence injectables must be free from pyrogen. Okay, so large volume parenterals are usually administered by C. Here the answer will be intravenous route. Large volume parenteral বলতে যাতে ভলিউমটা বেশি থাকে, more than 100. So normally আমরা saline use করে থাকি. Small volume parenteral, see here, it's contain what? See, the less than 100 ml. The answer is less than 100 ml. And preservative are not added to multi-dose injection, ophthalmic solution, single dose injection and nasal drop. So answer will be that C. In case of single dose injection, we cannot add any preservative, right? Vehicle commonly used for injectables include water for injection. Lastly, this is normal saline, vegetables oil, and all of the above. The answer will be here, that D. Okay, so vehicles অর্থাৎ যে ক্যারিয়ার আমরা ইউজ করে থাকি ইনজেকশন তৈরি করতে গেলে সেটা হচ্ছে ওয়াটার ফর ইনজেকশন হয়, নর্মাল সেলাইন ওয়াটার হয়, ভেজিটেবলস অয়েলও হয়, and all of the above, right? So next হচ্ছে question form, that is eye drop. So eye drop are sterile liquid preparation intended for, that is eye. Okay, so eye drop should be ideally hypertonic, hypotonic. Okay, next is that is isotonic and highly acidic. So isotonic. Okay, this is very important. That's eye drop always isotonic. Okay, so isotonicity minimize irritation and discomfort, right? So ideal pH range for eye drop, the answer will be 6.5 to 7.5. Ideal pH range for eye drop. Next is that is preservatives The next chapter, that is immunological products. Okay, so first question here, question from here. Immunological products are mainly used for, so here number C will be the answer, prevention and treatment of infectious disease. Okay, so immunological products that's provide, or you can say stimulate immunity against disease. Okay, so that is very important question. Next, what is this? There is immunity produced by immunological product may be only innate, only acquired, passive, or you can say genetic. So answer will be that C. Okay, আমরা কি কারণে ভ্যাকসিন নিয়ে থাকি না, ভ্যাকসিন provides active immunity while sera provides passive immunity. Okay, so that's immunity produced by immunological product may be active, or you can say that is passive. So active আমরা কোথা থেকে পাই, active পাই আমরা ভ্যাকসিন থেকে, and passive আমরা কোথা থেকে পাই, passive আমরা পাই that is sera থেকে. So next is that is here, sera are defined as preparation containing antigen, antibody, toxin, or enzyme. So sera contain ready-made antibodies obtained from immunology, that is animal or human. So answer will be B. It's contain antibody. Okay, ready-made antibodies. So sera provides which types of immunity? So this is passive or active or hate or innate. So the answer will be here, that is B, passive immunity. Okay, so sera are mainly used for what purposes? That is B, immediate protection after exposure. Okay, used in emergencies like snake bite, tetanus exposure. So that's time we can use that sera. Sources of anti-sera usually what? Plant, bacteria, that is immunized animal or human, and that's chemicals. The answer will be C, sources of anti-sera, that is immunized animal or you can say human. So major disadvantage of sera, that is C, risks of hypersensitivity reaction. দেখবেন যেখানে ইনজেকশন নেওয়া হয়েছে বা যেখানে ভ্যাকসিন সেরা নেওয়া হয়েছে সেখানে কি হয়, সেখানে হাইপার সেন্সিটিভিটি রিয়াকশন তৈরি হতে পারে। অর্থাৎ কি না, সেরা মে কজেস সিকনেস, সিরাম সিকনেস আর অ্যানাফাইলাক্সিস। Next, the vaccine or preparation containing what? Antibodies, live or killed microorganism or their compound, toxin only, and hormones. So it is there, that is key, a vaccine or preparation containing what? B, live or killed microorganism. Okay, vaccine provide which types of immunity? So vaccine provides, that is active immunity. That is very, very important. And next is that is live, that is attenuated vaccine contain what? Live attenuated vaccine content is the answer C, weakened living organism. Inactivated or killed vaccine contain what? Dead microorganism. Okay. And here that is example of a live attenuated vaccine, that is B, polio vaccine. You can say oral polio vaccine, OPV. And major disadvantage of live vaccine, that is C, strong and long lasting immunity. Okay, major disadvantage of live vaccine, that is B, risks of reversion to virulence. And what is toxoid? Toxoid are defined as, that is live toxin, inactivated toxin, antibodies, and killed bacteria. So toxoid are defined as B. These toxoid are detoxified toxin retaining antigenicity. Okay, so that is answered with the here B, inactivated toxin. Okay, and toxoid are usually they are used mainly against disease caused by here, that is bacteria producing toxin. Common example of toxoid, that is polio vaccine, tetanus toxoid, rabies vaccine, and BCG vaccine. So example is that is B, that is tetanus toxoid, right? So next is toxoid produced which types of immunity? That is C, active immunity. Okay, so next was C here. Bacterial vaccine are prepared by, that is B, culturing bacteria, that is followed by the inactivation. Okay, and viral vaccine is commonly produced using C here. This is that is fertilized egg or cell culture. Okay. This is very, very important. Inactivation of bacteria or virus is commonly done by, this is formaldehyde or you can say heat. Okay, and here see manufacturing method in case of toxoid and sera. Toxoid are produced, that's prepared by treating toxin with, this is C, formaldehyde. Production of sera involve, this is vaccinating animal and collecting blood. Okay, and here after blood collection of sera, that is after blood collection for sera, antibodies are obtained from, that is plasma or serum. Okay. Next what, this is from storage. This is very important part. That's immunological product usually require storage at cold chain. This is 2 to 8 degrees centigrade. This is very important question. Okay, so which of the following is critical for a vaccine? So this is cold chain maintenance. Okay, that means storage temperature. Sterility testing is essential for see here, see vaccine and sera. Answer will be that. Okay. So next what? Next, that is immediate protection after snake bite is provided by C, anti-serum. Okay, anti-serum. This is the immediate protection after snake bite. Long-term disease prevention is best achieved by sera, vaccine, analgesic, and antipyretic. So long-term disease prevention mainly you can use, that is CR, and so will be D, vaccine. Which immunological product does not contain living organism? So the answer will be the killed vaccine or toxoid. But in case of live vaccine, it's contain a weak living organism, killed vaccine, toxoid, or it contains a weakened microorganism. Serum sickness is associated with vaccine, toxoid, sera, and antibiotic. So that is C. This is sera. So serum sickness is associated with sera. Okay. So activity immunity differs from active immunity differs from passive immunity because what? Because this is long lasting. Okay. So active immunity differs from passive immunity because it long lasting. Okay. So next is, that is best immunological product for emergency treatment: vaccine, toxoid, serum, and booster dose. So the answer will be C and C. This is serum. Best immunological product for emergency treatment. Okay. So purpose of adjuvant in vaccine is to be enhance immune response. Okay. So here দেখুন এখানে, that is exam, that is quick summary. Sera, first of all, it's contain antibodies, it's produce passive immunity, and it's given, that is immediate action. In case of vaccine, it's contain antigens, it's given active immunity and long-term protection. Toxoid, it's contain inactivated toxin, and it is produce, that's active immunity. Okay, so this is very important. And next is what? That is see, in case of manufacturing, how to manufacture, manufacturing, culture, inactivation, purification, and quality control, and cold temperature for storing of vaccine. This is 2 to 8 degrees centigrade temperature. This is very important, right? Next is what? Next is, this is chapter number 6, pharmaceutics manufacturing plant, UCQA and CGMP, right?